Good afternoon and good evening, friends and colleagues from around the world. Welcome to this webinar from the World Health Organization, announcing the global launch of the new report, Throwing Away Our Health, the impacts of solid waste on human health, evidence, knowledge gaps, and health sector responses. We're so happy that you could join us. Before we commence with our very packed and informative program, a couple of moments of housekeeping. All participants are automatically muted by the webinar organizers, but please do use the chat for introductions, questions, and comments. This webinar will be recorded. The recording and slides will be shared with all registrants after the webinar. And although the webinar is in English, in your version of Teams, you should be able to enable live subtitles and select your preferred language. To do this, you go to the three dots at the bottom of your screen, select language and speech, turn on live captions, and then choose the caption that you would like. Some versions of Teams also enable you to immediately translate the slides into your language of choice. Please do test that functionality if you would like that. Now, without further ado, we would like to commence with our program, and our opening remarks will be provided by Mr. Bruce Gordon, who is Unit Head of the Water, Sanitation, Hygiene, and Health Unit at the World Health Organization. Bruce, over to you.
Well, thank you very much, Dave, and welcome everybody. I couldn't be more excited about this report that Dave mentioned, Throwing Away Our Health, the impacts of solid waste on human health, evidence, knowledge gaps, and health sector responses. And I just wanted to say, of course, we're gonna preview the report, but this 1 hour event is much more than that. We have experts, country case studies, and we're going to talk about real on the ground experiences and solutions. So we really hope you'll be able to learn a lot, and we expect that. So many of you have been involved, and many of the institutions that you represent have been involved in these issues on waste management for quite some time. And as a WHO, we're very excited to be here because we've obviously seen the science and the evidence, and you'll hear, I think, a lot from our experts about the rise of the trends that we're seeing in waste and the potential impacts on health. We've heard member states' concerns, and of course, the public is getting very anxious. So really, the goal of this webinar is to give you, like I said, a preview of the report and why WHO is involved and what the health sector can do, but it's really to also encourage collaboration across all sectors. We know that waste management is not just about cleaning up our cities, but it's about health, it's about dignity, and a lot can be done. So as Dave said, there's a tremendous amount of speakers and material to be covered. So I think let's just get started. And I'd be very happy to pass the floor to my colleague, Dr. Sophie Boisson, who will run through the report. So over to you, Sophie.
Thank you very much, Bruce. And Dave, I will just you can share the slides. I will just ask you to advance them as I go through the slides. So in the next couple of slides, I'll give a very quick orientation on this report. But we've posted the link in the chat, so please feel free to explore it in more details. Next, please. So why this report and why now? So we really know that waste generation is rising faster than ever, but also the waste composition is getting more complex, which represents some unique challenges to manage it safely. We also know that waste is already polluting our environment, sometimes causing irreversible damage to ecosystems, but also we know that it contributes to climate change. So over the last couple of years, countries have been asking WHO for support on this issue through World Health Assembly resolution that were adopted in 2016 and 2023. Next slide, please. So what will you find in this report? So I've highlighted on the right-hand side the key chapters, but essentially this report focuses on municipal solid waste, but we also signpost to key resources on other waste streams. It's designed to complement existing internal and external reports on this issue. But mainly we summarize what we know on health risks, on potential health impacts, and also on evidence gaps. And finally, the last chapter is about reinforcing established recommendation in the waste sector, but also highlighting how the health sector can intervene and collaborate to address this challenge. Next slide, please. So this is this slide, and you will find in the report a chapter that gives a brief summary of the main data and trends on municipal solid waste management. And this is from the World Bank Water Waste Report, but also the more recent Global Waste Management Outlook report, which was published last year by UNEP and ISWA. As we know, the report highlighted that globally waste is expected to nearly double in 2050. We see that high-income countries are generating a huge amount of waste, and while they have typically advanced systems and regulation to deal with it, they still face a number of challenges. That includes dealing with complex waste streams, recycling remains limited, and the transition to a circular economy is still nascent. In low middle income countries, of course, there's a rapid growth in the amount of waste that's generated, and in many cases that far exceeds the capacity of countries to manage it safely. And this is one of the key figures I wanted to show from the last Global Waste Management Outlook report, showing that 38% of municipal solid waste is uncontrolled. That means not collected, or collected and then dumped or burnt in the open. And disposal of municipal solid waste in landfills remains the most common management methods. Next slide, please. So inadequate solid waste management exposes people to a wide range of hazards, and that's what's represented, you can see on this slide. That includes biological, such as enteric pathogens, infectious agents from healthcare waste, vector-borne pathogens, chemical, a wide range of chemicals or their byproducts that may be present in the air, in the soil, in water, and in food. Physical hazards like cuts and injuries, musculoskeletal injuries, burns due to open burning and fires, and so on, as well as very important psychological effects and stress and anxiety, reduced quality of life, and so on. On the right-hand side, you can see some illustration of some of these hazards, and at the bottom, you could see some of the multitude of chemicals that may be released through open burning, incineration, or leakage at dump sites and landfills. Next slide, please. But it's important to highlight that the level of risk really depends on the level of control. And that's really illustrated with this ladder of services by Dr. Wilson, Andy Whiteman, and colleagues. That really clearly shows that the level of risk really decreased as you progress from having no services in place to having services in place with full level of operational control. Next slide, please. We know that vulnerable groups face much higher risk than others, and that include waste workers, especially those working in informal settings, but also communities that don't have access to regular collection services, or those living near uncontrolled or poorly controlled management sites. Vulnerable groups include especially women and children. But I also wanted to note that at the end of the day, solid waste affects us all. It pollutes the environment and the ecosystem we rely on. So it really has a massive impact on all of us. Next slide, please. In the report, you will find a chapter that summarizes some of the epidemiological evidence, looking at the links between solid waste and health. And this chapter was developed based on a systematic review that was conducted by Giovanni Vinti and colleagues, looking at the impact of solid waste management on health, and that was published in 2021. And we also did a rapid scoping review to identify more recent systematic reviews. What we found is that the epidemiological evidence is largely from high-income countries. The studies have been largely conducted among workers and population living near incinerators or landfills. Some studies have reported some association with certain health outcomes, like cancer, certain types of cancers, congenital anomalies, adverse birth outcomes. Some have reported cardiovascular and respiratory diseases, mortality, or certain association with biomarkers. But the evidence overall is very inconsistent. Some of the earlier studies that studied older facilities, those that were operated before stricter regulation were in place, tended to show increased risks. But there's still lots of existing gaps. We also noticed that the evidence from low middle income countries, where the risks are likely to be the greatest, because of the prevalence of uncontrolled approaches, it's much more limited. But I wanted to just conclude on this slide that assessing the full extent of the health risks and impact from waste is really challenging. Next slide. And in the report, you will find a short section describing, a lot of the methodological challenge, a lot of the limitation in assessing the impacts, in quantifying these impacts. And here on this slide, you could see some of the example of some of the limitation and some of the research that's needed to fill some of the gaps identified. Next slide. So in chapter 6 of the report, we end by highlighting that despite this limited evidence, we know that action can be taken. So in this chapter, one section is dedicated to really reinforcing some of the commonly accepted recommendations in the waste sector, such as applying the integrated sustainable management principle, the waste hierarchy, but also a lot of the commonly accepted recommendations in the sector that are highlighted here on these slides. Next slide. And you will also find a lot of details on how the health sector can contribute, what is the health sector role in waste management. So first of all, I think it's really important for the health sector to lead by example, by minimizing and managing healthcare waste safely and sustainably. But also, the health sector has a key role to play in a number of other functions, like overseeing the health and safety of waste workers, strengthening the evidence, as we touched on in earlier slides, supporting the inclusion of health in waste management policies and standards, monitoring and assessing health risks, and strengthening the capacity of the health sector on these issues, as well as raising awareness among communities. So this is very rapid overview because we don't have much time, but I really invite you to dig a little deeper into the report at the link that I share with you. So here in the next segment of the webinar, we'll hear some clear example of to illustrate how the health sector can engage on this issue. So we will first hear from Professor Vanessa Cruvinel. She's a professor in epidemiology from the University of Brasilia, and she will talk about how waste management intersects with vector control and dengue prevention. Our second example will be presented by Dr. Sonia Dias at WIEGO. She's a global expert on inclusive waste management, and she will talk about occupational health and safety, but also how to reduce climate-related impact among waste workers. And then finally, we'll hear from Professor Samuel Agyei-Mensah. He's a professor of population and medical geography at the University of Ghana, and he will talk about urban health implication of open burning, as well as highlighting some of the local intervention. So with that, I will ask Vanessa to turn on a camera and over to you, Vanessa. Thank you.
Hello, can you hear me?
We can hear you well, Vanessa. Thank you.
Yes, so thank you for this invitation. It's a pleasure to be here because I am so focused on this topic. We know that Brazil's population is estimated in more than 200 million people, and we generate for each person 1 kilogram of waste per day. So the incorrect disposal of waste is a very big problem and challenge in Brazil. Despite we have the national policy of solid waste that obligates all the 5,000 municipalities to close their open dumps, we still have 3,000 open dumps operating now. So we can imagine the amount of waste that is incorrect disposed and how it can reflect in diseases and also to the contamination of the environment and causing a lot of problems to the population. And a very big concern is related to the vector-borne disease, since the incorrect disposal of waste can cause a lot of problems related to vectors. And since 2021, we started a project related to a multi-sectoral approach in Brasilia, Brazil, the capital of the country, where it hosted the biggest open dump in the Latin America, and also the second one in the world for almost 60 years. It was funded by the WHO with the TDR project, as you will see in the video now.
A structural city, Brasilia, the country's poorest city, which hosted the largest open dump in Latin America for almost 60 years, until it was closed by the government in 2018.
We discovered that one of the challenges among these people were the vector-borne disease. When we interviewed these people, they told us that more or less 30% of them have had dengue before. But when we analyzed their blood, we could confirm that more than 70% of them have had dengue before.
In collaboration with the local communities, researchers and scientists from multiple sectors set out to develop public health solutions to reduce the incidence of arboviral infection in this vulnerable population.
The project has 3 objectives. 1, to assess sanitary conditions in poor people, especially in vulnerable areas. Second objective was improving entomological surveillance and entomological control using new technology. Third objective was analyze the water quality and how these people store water.
After assessing the sanitation conditions by speaking with community members and understanding their epidemiological history, it was clear that the community knew how to prevent vector-borne diseases, but lacked the resources to do so. By using a multi-sectoral approach that involved not only the health sector, but also the education, environment, as well as water and sanitation sectors, the project was able to equip communities with resources and tools to prevent infection and reduce the spread of disease.
I think that our results will confirm results in other areas in Brazil and outside Brazil, that this strategy really is a success to control Aedes aegypti and dengue.
And after this project, we could conclude that the number of cases of arbovirals in structural city, that is the poorest city in Brasilia, has decreased more or less 60%. So really believe that the multi-sectoral approach is the key to solve the problems. And the good news is that the area where is still irregular in the structural city, nearby the area of the old open dump, will be regularized and will receive all the sanitation supply. So it's a very good news, and we know that with no supply, sanitation supply, people cannot have health. Thank you.
Thank you very much, Vanessa, and we'll transition. Of course, workers form a big part of this population who suffers from these vector-borne diseases. And I will transition over to Sonia, who will tell us a little bit more about workers, but also highlighting also how these risks are exacerbated by climate change and what to do to address those risks. Sonia, over to you.
Thank you so much. It's a pleasure to be here and share a little bit about our work around the connections between solid waste, health, and climate change. The next slide, please. Well, we already know, the biggest challenge of solid waste management overall, but my job here is to focus on climate emergency. We already know that climate change intensifies social environmental challenges in cities and directly affects vulnerable workers such as waste pickers, particularly in the context of climate change. Climate change, OHS really closely linked heat waves, torrential rains, and other climate phenomena are impacting workers' health over the world, including informal waste pickers. And waste pickers, despite their enormous contribution to solid waste management overall, and also to climate mitigation, they are still invisible in climate change research and policy. Next slide, please. So our work at WIEGO has been focusing precisely on documenting climate change impacts on workers, working conditions and health, because we believe that this can help shape investment on improving work infrastructure and also to support adaptation strategies that can prevent diseases and injuries and improve physical and mental health and well-being, and thus protect workers' health. So in 2023, WIEGO carried out an exploratory research in Brazil. It was a survey, nationwide survey, and also we did qualitative research. And heat waves and flash flooding came, as the most prominent climate phenomena affecting workers. And as we researched back then, we were really seeing that workers were reacting and developing some some coping strategies, but that they needed a stronger and expanded network to solve structural problems. And this led us, next slide, please, we saw that we needed to document more how workers were being impacted by climate change, and we started a project called the Near Real-Time Monitoring of Climate Change events, and this covers 6 capital cities in Brazil in all of our regions, and we monitor 16 cooperatives, and we are documenting the monitoring system. It relates extreme weather events, heat waves and flooding, to the impacts on their workspaces, on their working conditions, health and livelihoods. Next slide, please. So some of the emerging insights from our documentation of near real-time monitoring, there is an urgent need to raise awareness about how to respond to climate change impacts, and we need to strengthen early warning systems so that workers can prepare themselves in advance. We have, in our climate monitoring, found out how pre-existing infrastructure deficits worsen the impacts of floods and heat waves, especially for workers' health. And this also impacts on productivity because you have absenteeism because they get sick or they also cannot reach their workplace. We have lower quality of recyclables and lower incomes. And the mapping highlights the need for climate resilient workspaces, including the upgrading or building of recycling warehouses with better drainage, flood-resistant storage, and improved ventilation. And for those working in the streets, this calls for the innovation around urban infrastructure in open spaces that can improve working conditions of workers. Next slide, please. So to conclude, I just want to really highlight the importance of associating the work infrastructure, the deficit of work infrastructure, and particularly the inadequacy of existing work infrastructure in terms of coping with climate change. We know by literature review that climate change tends to exacerbate, pre-existing vulnerabilities, and our research is showing that. So it's important for us to invest on climate change sensitive working infrastructure as a way to improve workers' health. Having PPEs is not good enough. We really need to tackle more structural problems. And we also need to address social protection because this is the cornerstone of climate adaptation. We need to document health risks related to climate change and enable workers to access health care. We need emergency relief grants to cope with climate disasters. We need health and climate capacity building to help workers cope with heat and also to know how to identify the system. We need preparedness. We need early warning systems that help workers anticipate and respond to climate risks. So place of work matters, whether workers work in the streets, in sorting centers, or in open dump sites. We need to invest on improving work infrastructure because this is key to workers' health. Thank you very much.
Thank you so much, Sonia, for this is very relevant, is so relevant and interesting example. So we'll transition now to Professor Samuel from Ghana, from University of Ghana, who will talk about urban implication of open burning. Over to you, Samuel.
Okay, thank you very much, and it's a pleasure to be part of this meeting. The title of my presentation is Solid Waste Management and Health in Accra. And my name is Agyei-Mensah from the University of Ghana. Accra's municipal solid waste crisis is a manifestation of several factors. Essentially, we've not been able to collect the waste that we generate, and we are told that between 1,500 and 2,800 metric tons of waste is generated daily, and the population of the Accra metropolitan area is about 284,000. This is based on the recent population census conducted in 2021. So large amounts of the waste exceeds the collection capacity. And reports indicate that 70% of the waste generated is collected. But there are other reports which also indicate that between 40 to 55% is actually collected, which provides a persistent challenge of managing waste within the metropolis. On the far right, there are common health. On the far right is Zoom Lion, that is a private formal waste collection agency, mostly collecting waste within the middle and upper class areas. On the extreme left, we have the informal waste collectors, what we call the motorized tricycles, mostly operating within the low class areas. And the middle, we have the communal bins that are provided by the assembly to serve as a collection points for the disposal of waste. Next. Yeah. The literature on health and waste management has well been documented, but we could see that there's open burning, for example, releases fine particles, which causes a lot of respiratory illnesses, including bronchitis, asthma, etc. There's also evidence that solid waste management could also impact our heart-related diseases, and the evidence on open dumping and vector-borne diseases as manifested in cholera outbreaks and malaria is also very, very common within our context. Next. So how do we address waste management, or how has waste management been addressed within our context? Accra has moved towards formally recognizing and integrating its informal sector to improve waste management efficiency. And as we could see, the former mayor of Accra, Agyei-Mensah, was very instrumental in bringing informal waste collectors into the mainstream waste management system. And he received, or Accra received, an award by the Bloomberg in 2019. Next. Yes, so the WHO, through the Urban Health Initiative, which was established in Accra in December 2016, it was a pilot scheme, the first of its kind in the African continent. And it was in response to the World Health Assembly resolution that mandated WHO to build health sector capacity to work with other sectors. It started with the mapping of air pollution sources within the Accra metropolitan area, issues related to identifying the key stakeholders, and also making sure that 4 key sectors, solid waste, energy, transport, and land use, were embedded within the health sector, driving air pollution and other health-related issues. Findings from the World Urban Health Initiative shows that waste management sector found that seasonal air pollution, which is a major contributor of black carbon, could lead to a 50% reduction in emissions. And also analysis of ambient air pollution found that if air pollution is reduced to WHO standards, guidelines, about 1,790 premature deaths would also be prevented. And in addition to these alternative scenarios and policy options that were tested, the urban health project through the Breathe Life campaign was able to reach out to very influential people within the metropolis, queen mothers, the mayors, etc. And they were able to make significant campaigns to reach to a wide populace, especially in terms of how to be able to reduce air pollution. I was personally involved in organizing some of these workshops. We were able to bring nurses, doctors, and the media to educate them about the sources and causes of air pollution. And I think this made a very significant impact, especially to the health workers. Next. In addition to the urban health initiative, there are other initiatives, for example, the Bars Boys in Accra that occasionally help to remove clogged gutters within the streets. And this I find very interesting because places like Kigali in Rwanda, most of the drains are covered, unlike Accra, where most of the drains are still open. And I think when it rains, it also provides some of the avenues for the breeding of some of these vector-borne diseases. On the extreme right, we have ARICOP as an initiative by the Accra Metropolitan Assembly, backed by the government of Ghana, to process municipal solid waste into valuable compost and recyclables such as plastics and metals. Next. Yeah. So to conclude, a healthy city must have an efficient and proper handling of waste to create a safe and pleasant urban environment. Thank you.
Very much, Samuel, for this very interesting updates. And I will hand over now to our moderator, Megha Rathi, for taking us through a moderated panel discussion. Over to you, Megha.
Thank you. Thank you so much, Sophie. Thank you for an excellent overview of the report. And to all our case study presenters, I think it was excellent to see how the multi-sectoral approach is important when we talk about solid waste management, the effect of climate change on the workers' health, and the study that Professor Samuel has presented. And I think it's a perfect segue to our next segment, which is a panel discussion. I would like to invite our panelists, Dr. David, Mrs. Miriam, and Ms. Nicole, who will dig deeper into the challenges and solutions of solid waste management. We'll have two rounds of questions for our esteemed panelists, and I can start with you, Professor David Wilson, who has a vast experience in international waste and resource management. He is an independent consultant and visiting professor at Imperial College London. Professor Wilson, in your recent publication, Learning from the Past to Plan for the Future, it provides an account of the evolution of waste and resource management since 1970s and reflecting on future directions and priorities. I think it'll be interesting for us to hear from you if you can provide us an account of how you see the landscape of waste management differ from the past, and what new or intensified public health risks would emerge if we fail to act now, and especially as we heard from Sophie that the waste is projected to double by 2050. So maybe over to you, Professor Wilson.
Thank you. Can you hear me?
Yes, loud and clear. Thank you.
Good, thank you. Formal municipal solid waste management as we know it dates from back to the 19th century, and it was introduced to protect public health and prevent the spread of infectious diseases such as cholera. The early focus was on waste collection, getting waste out from underfoot, and it took another century before emerging environmental concerns in the 1960s began to focus attention on controlling treatment and disposal of controlled wastes. Excuse me. Early regulation focused on eliminating uncontrolled dumping and open burning and reducing dust from incineration, which was followed rapidly in the high-income countries by the gradual ramping up of standards to current high levels of environmentally sound management. In the 1990s, many developing countries were only collecting municipal waste from less than half their population, and open dumping and open burning was still the norm. Since then, progress has been fast in the upper middle income countries and in larger cities. But the Global Waste Management Outlook, the latest version from UNEP and ISWA, estimates that 2.7 billion people still lack access to waste collection services, with a significant proportion of the collected waste still going to dumping and burning, which is a global waste emergency. Without urgent action, it's going to get worse because the quantities are projected to double, focused on the global south, by 2050. So reaching out to those unserved and underserved communities is essential, not just to protect public health, but to mitigate climate heating and reduce plastics pollution. For example, there was a recent Nature paper that showed that uncollected waste accounts for more than 80% of macroplastic debris emissions to the environment and available to enter the ocean. So I see this WHO report that we're talking about today as important in emphasizing the need to extend good municipal solid waste management services to everyone to protect public health. In the global north, we tend to take solid waste management for granted, but the changing nature of wastes continues to challenge the waste and resources sector. E-wastes are a good example there, with fires caused by the crushing of used phone batteries being literally, if you excuse the pun, a hot topic. Siting new facilities is also a challenge, as concerns about past pollution and health impacts from older sites with lower standards naturally causes people living nearby to be anxious about living beside a new site. So I will stop there.
Oh, thank you so much, Professor Wilson. I think you provided an excellent, overview again about the history and the scale of challenges that we face, today with the changing trend of waste generation that we're having. And this takes me to our next panelist, Nicole Weber, who is a waste management specialist at Resource and Waste Advisory Group Waste Aware. Nicole has also been a part of the team that authored the publication Throwing Away Our Health. Nicole, the question to you is, you've been involved in reviewing the evidence for WHO report and building on the work from the review by Giovanni Vente and colleagues. As a specialist in waste data systems, how will you rate the evidence base in the report? Do you see any significant differences between regions around the world, and how could we bridge the gap? Nicole,
Hi, everyone.
over to you.
Yeah, hi everyone, and thanks very much. Just building on David's points, one of the reasons communities remain concerned about new waste facilities is that most of the evidence we rely on today comes from historical epidemiological studies in the global north, where many of these studies looked at older facilities rather than modern ones with today's emission control standards. And naturally, that legacy shapes how people respond to these new facilities. And when we talk about the evidence base, I think it's important to acknowledge that we already know enough to act, especially in the global north, but we do see meaningful regional differences. And that's not because the risks are lower elsewhere, but because the evidence is weaker, particularly in the global south. And this really reflects a major research gap and not an absence of harm. And it actually highlights how inadequate waste management in many of these regions actually leads you to higher risks. And though we do see gaps in exposure data, as many of the studies used various data collection methods, it's also super difficult to have comparable data with this. So that's why we really need standardized, harmonized health impact assessments, human biomonitoring, and environmental monitoring, which are super important to help us identify which pollutants are present, where are they concentrated, and who is being exposed. And this is especially important for frontline waste workers and communities living in underserved areas or those neighbouring recovery and disposal facilities. And then even in the global north, we do see that we still need evidence to be continuously reviewed and updated, since emerging contaminants like microplastics or BPA and PFAS, just to name a few, still raise questions about the long-term health impacts, and we still don't fully understand the hidden costs of these pollutants. So strengthening the evidence base is essential in both the global south and the global north if we really want to protect communities. And without this, it's difficult to quantify the real health burden or design policies that genuinely protect public health. So we already know enough to act, but we also just need better, more consistent data to guide those actions and to strengthen research. And standardized biomonitoring and surveillance can really help us understand the full health burden in all regions of the world.
I think, thank you so much, Nicole. I think that's important that, you highlight the gap in the evidence base that we have between the regions. But it's also important for us, how important evidence is when it comes to policy development globally. And I think that's where our third esteemed panelist comes from. Miriam Medel-Graciez. Our next panelist is the head of the environment team at the Permanent Mission of Mexico in Geneva. Miriam has had an extensive experience in multilateral climate and environmental diplomacy and have been involved in hard diplomatic negotiations related to chemicals and waste, as well as the plastics treaty where I was with you the last time. I have a specific question for you, Miriam, on the plastics treaty. We have seen that how difficult the global plastics treaty negotiations have been. What lessons can we draw for future talks, and how can the health sector make sure that the health risks aren't sidelined and these environmental negotiations include the health aspects in there? So over to you, Miriam.
Thank you very much, Megha, and it's really an honor to be here. And I will try to bring in a little bit of that perspective from Mexico, from this negotiation that has become probably the most difficult that we have had to deal with as a collectivity, as multilateral organization within the UN in the recent times. First of all, I think today's report really confirms something that Mexico has been advocated all along, the plastic negotiation since its beginning, which is that when waste is mismanaged, health suffers. And this is never an abstract, this is always a reality. And we have heard from previous speakers how the mismanagement of waste affects workers, families, communities, and then we have these health concerns coming up in the negotiation. So what are the lessons that we can draw up from the failed so far negotiations, and then looking ahead to the next leg of negotiations whenever those happen? So one, and Mexico will continue to advocate for this, we need to look at the entire life cycle of plastics. Mexico consistently pushed for a comprehensive approach, starting with production and design, looking at chemicals of concern, and not stopping at waste management. The report that you have produced today, that you're presenting today, shows very clearly that downstream solutions alone are not enough. So if we do not reduce and redesign upstream, the waste problem will simply continue to be unmanageable. Mexico, as you know, along with Switzerland and over 100 countries, advocated under Article 3 to propose binding measures. And for us, our rationale is that the treaty, and continues to be, that the treaty should tackle problematic plastic products and chemicals of concerns and set a path towards sustainable levels of primary plastic polymer production. So again, if we do not address what is produced and how it is designed, we will keep pushing avoidable health risks downstream onto communities and waste systems. Another key lesson, and we are just waiting for the next negotiation cycle to continue advocating for this, is that health has to be treated as central and not as an add-on to the treaty. So we have made the case, and we will continue to make the case, that plastic pollution is not only an environmental issue, but a public health priority. And that's why we have been supporting stronger links with WHO and other organizations, and the inclusion of health consideration across the life cycle. Another strong point of convergence is that both in the treaty negotiations and in this report is equity. Informal waste workers, marginalized communities bear a disproportionate burden of exposures, and then protecting them means stronger occupational health and safety, recognition of their role, and ensuring that transitions towards safer materials and systems are just and inclusive. And finally, we want a treaty that is science-based, and that all decision making is science-based. For us, probably the strongest key takeaway is that when health is placed at the center, when it is supported by science, cooperation, and inclusive governance, it strengthens the environmental outcome, and then everybody wins, and we have to go beyond our siloed approach of environment, health, and the other sectoral approaches. That is a lesson from the plastic negotiations that is directly relevant to the broader agenda on solid waste and haste, and we will continue to advocate for it. Thank you.
Thank you so much. I think you provided an excellent perspective that, we have to look, health has to be in the center of these negotiations, and we need to look at a life cycle approach. If I may just continue with you, Miriam, we know that the health sector also contributes to the problem as a major generator of waste, including plastics. What can the sector do, to reduce its environmental and waste footprint, and how can it work with the other sectors to tackle, the wider waste health, challenge that we have? So over to you again.
Thank you very much. And I mean, for us, this question is very important because it reminds us that the health sector is not only affected by waste, but it's also a key actor in shaping solutions. First of all, the health sector needs to lead by example. Healthcare facilities generate significant amounts of waste, including plastic and hazardous materials. This was also very evident during the plastic treaty conversations. And then from the perspective of Mexico, reducing that footprint starts with practical steps. Sustainable procurement, reducing unnecessary single-use plastic when safe alternatives exist, proper segregation at source, and safe environmentally sound treatment. These measures would directly protect health workers, patients, and communities. For Mexico, from a public policy perspective, actions work best when they are part of a broader policy framework, and not when they are isolated initiatives or isolated technical fixes. So while I'm very happy that this meeting is taking place today, because a few days ago, on December 9, our Congress approved a general law of circular economy, which promotes prevention, better product design, reuse and recycling, and aims to reduce waste generation at the source. The law was proposed by the government, by the Ministry of Environment, but it was created together with the Ministry of Health and other ministries, actually. And for us, it really sends a very clear signal that managing waste is not about disposal, but it is about how products, including medical supplies, are designed, procured, and used in the first place. And we believe that this is where the health sector can really make a difference by aligning procurement and waste practice with circular economy principles. At the same time, a little bit what I said at the end of the last question is that the challenge cannot be addressed by one sector alone. So we really need a whole of government approach. We really need a whole of society approach where everybody chips in and where everybody plays their role, but collaborates with each other. I know it's incredibly difficult. It's probably the most difficult thing that governments and societies do, but we have to do it. We really have to start talking to each other internally before going back to negotiate other instruments. And finally, the health sector has a unique role in making risks visible. So through surveillance, exposure monitoring, and documenting the health impacts, it can translate waste and pollution into evidence that policymakers actually understand and that is relevant for people to put pressure on their elected officials. So for us, in our opinion, this really helps shift the conversation from waste as a technical issue to waste as a health and environmental priority. So in short, the role is threefold: reduce its own footprint from the health sector, align with circular economy and prevention policies, and act as a bridge across government and society. And this is how we really think that we can really create systems that are not fragmented and that can be created to protect both people and planet. I end with this, and I apologize with that because I will have to go. I learned a lot, and really to see this type of initiatives and the contribution from everybody in the previous panels really encourages me and encourages my government to keep working for this what we consider an essential challenge that needs to be tackled multilaterally. Thank you.
Thank you so much, Miriam. I think it was an excellent, overview that you provided, and how health sector can lead by example. Thank you so much, and for your time as well. So I think we're just looking at the time, and I would want to come back to you, Nicole. We talk about equity, and another important aspect that we highlighted is the disproportionate impact of waste mismanagement on frontline workers, marginalized communities, women and children. So what steps, governments can take to protect them, and how could these actions benefit everyone? So I think that's something that's been coming over and over again.
Yes, no, thank you for the question. So yeah, when waste isn't collected regularly, unserved and underserved communities are often left with no choice but to self-manage their waste, and that's usually through open burning or open dumping. And at the same time, informal waste workers face some of the highest levels of exposure as they handle waste directly. And the report highlights really well that both groups are exposed to a mix of physical, chemical, biological, and psychological hazards. And the risks actually tend to be higher for those living near uncontrolled recovery and disposal sites or unmanaged waste hotspots. So the first and most impactful step that governments can take is actually to improve basic waste services to underserved areas. And this includes some no-regret investments, such as improving reliable collection, improving control levels at recovery and disposal sites, and eliminating open burning and dumping. And these measures will actually directly reduce uncollected and unmanaged waste in the environment and significantly reduce some of those adverse health outcomes that we see. And secondly, governments should also integrate the informal waste workers into the formal system and just recognise them for their very essential role in resource recovery. And along with this, they should be given access to basic health and social protections, fair wages, personal protective equipment, social support schemes, and health insurance, just to reduce their occupational risks. And this also helps just to strengthen the overall performance of the waste system as well. And while frontline workers and marginalised communities usually are the most exposed, inadequate waste management ultimately affects us all. And because disease outbreaks just don't stay confined to low-income neighbourhoods, and pollutants don't really respect boundaries, and methane from decomposing organic waste and black carbon from open burning drive climate change, and plastic leakage also just chokes our rivers and oceans. So even if we aren't the ones living next to a dump site, we're ultimately all still affected. So the actions that protect vulnerable groups actually protect everyone, as they create cleaner, healthier cities and reduce the healthcare burdens, and build more resilient waste systems for us all.
Yeah, sorry, I was muted. I think this is really important, that you highlighted that we need to have inclusive policies where we include the marginalized and informal sectors as well into the policy and decision making. So this comes to my, I think to the next question that we have for Professor Wilson, which is on the global waste management outlook, which report that highlights the cost of inaction and benefits of a circular economy. How can these models be made more practical and can health risk be addressed here? So I think this would be the final question for the panel discussion. Over to you, Professor Wilson.
Nicole has very adequately addressed much of this in terms of extending services to unserved communities. But one of the key interventions is likely to be segregation at source of wet organics from dry recyclables, which allows recyclers to work in more hygienic conditions, to recover more materials, achieve higher selling prices, and to make a better livelihood for themselves and their children. Separating and collecting the dominant organic fraction, which is more than half the waste in most of the global south, separating that at source also provides a clean feedstock necessary for organics recovery to thrive. And if that's implemented properly, that intervention has the potential to more than halve the quantities of waste requiring safe disposal, which in turn makes the issue of extending collection to all and eliminating open dumping and burning much more realistic. And similarly, in the global north, we need to progress rapidly towards a more circular economy, which recycling, reuse, reduction is one part of that. But as well as moving to a circular economy, at the same time, we need to continue to ensure that all wastes are safely collected and that residual wastes that cannot be reused or recycled are safely managed in environmentally sound facilities, which brings us back to the purpose of this webinar today. The basis of municipal solid waste management continues to be protecting public health. Thank you.
No, thank you so much, Professor Wilson and Nicole. This has been a very exciting panel, and especially as you highlighted the need for circular economy and then ways to be safely collected and managed effectively. I think these are key points which we've been takeaway that I have. And before I hand it over to Bruce, we have for his final remarks, there is a pre-recorded message from our UNEP IETC colleague Felipe Dall.
It's an honor to be here representing UNEP International Environmental Technology Center in the launching of this report, Throwing Away Our Health, developed by colleagues at the World Health Organization. Here at UNEP IETC, our work is mostly focused on waste management. And we are very happy to see that the report that we produced here last year called Global Waste Management Outlook provided meaningful contribution to the report being launched today. In this report that we did last year, we showed that the amount of waste being generated in the world is increasing and increasing over the time. And we need to take action, otherwise there will be no waste management infrastructure able to cope with this increasing amount of waste being generated. And we also try to estimate the impacts to human society from the waste mismanagement practices around the world. However, we also showed that by taking proper action and promoting a circular economy model of waste management, where the most important strategy is addressing or promoting waste reduction, could lead to a decrease on those negative impacts and even generate net gains to societies from the circulation of materials and from less waste being generated. To conclude, I wanted to bring the attention to some waste streams that are increasing in recent decades, such as electronic and electric waste, plastic waste, chemicals of concern, and particularly pharmaceuticals waste stream, which can lead to the antimicrobial resistance. To conclude, at IETC, we remain available to collaborate with World Health Organization, addressing the issue or the nexus between human health and waste management issues. And let me highlight that still the most important strategy and the most effective strategy is to work to reduce the amount of waste that we generate. By doing that, we will eventually reduce the negative impacts of waste being generated to human health. Thank you.
Okay, well, thank you all so much. We were determined to close this meeting promptly at 3 o'clock Central European time. We're just a few minutes over. I just wanted to say thank you sincerely to all the speakers, the moderators, and especially to all of you that have joined. I think all of us have been, well, I've been monitoring the chat. There's some really incredible comments and resources that have been offered, and actually really nice questions. So I think we're going to have to return to this. We've decided that we'll have another webinar or a Q&A kind of format where we'll kind of dig into this in some depth. But I think what's clear is, yeah, so we have some unanswered issues, but that allows us an opportunity to revisit this in January. This is one of our last, events of the year from WHO. So we recognize things are winding down, and we'll have to re-energize this as we move into 2026. But it was clear that, we're looking at this more from a health perspective. But I think we heard from everyone that we need a sort of this whole of society integrated partnership approach. And even within the health sector, I mean, we heard urban health initiative, healthy cities, looking at this from an air pollution perspective or a wash perspective. But certainly, whether it's communities at the community level or multilateral processes with the plastic treaty, we should use every tool in the toolbox. So we look forward to exchanging more information with you. We apologize that we haven't had the time to kind of have the deep conversation in response to your questions, but really this is an exciting area, a concerning area, and really privileged that all of you in this community have come and attended. We know it's not an easy time, but excellent work. So with that, I'd like to close this, and we will be in touch. I wish you the very best for the holidays. Thank you on behalf of the team.